Lindsay knows this one, but I don't see any other guesses. Looks like David's onto the scent. Yes, it's a terrible joke. All right, well done, y'all.
Thanks, Adam. Let's see. Give it one more minute. While we're giving it another minute, if you could enter your name, pronouns, and your agency in the chat. Nice, thank you. Okay. So let's get started. I want to remind you all that there's two different ways for you to provide feedback or comment on our homeless system. So you can submit a comment from the link on the HSSN webpage. You can also elect to do a standing public comment item. And these items are limited to 2 comments per meeting at the designated time. Each are given 2 minutes. Me and Adam, so the chair and vice chair, will work with county staff should the public process need refinement. To make a comment during a HSSN meeting, you have to direct request within the Zoom meeting to Lindsay Dent by 8:45 today. Include a quick topic description and organization you represent. The first 2 requests received will be provided an opportunity to speak for 2 minutes. Additional comments can be submitted through the online public comment link. And if there's no request for public comment, you'll just need to follow the link. We can't allow an open floor during the public comment section of the agenda. We're just bound in a few ways that make that, unfortunately, not possible. So please either submit via the link, or if you want to make a public comment today in the meeting, just have that to Lindsay by 8:45 a.m. Lindsay Dent. Direct message her in the Zoom chat. Okay. So perfect timing. I'm gonna turn it over, Nicole, if you're ready, to Nicole Singh, the Homeless Services Division update. Nicole, you have the floor.
Thank you, Charlie. Hey, folks, good to see you. My name is Nicole Sting. I use she, her pronouns. A lot of familiar faces today, and well, rather familiar names and some new names as well. I'm with Washington County's Homeless Services Division as our Strategic Initiatives and Relations Manager. And as part of the new practice, we're providing regular updates to the space on the happenings of the division. First and foremost, we don't have anyone on the line that's supporting Severe Weather Shelter. They are off doing that work right now and reporting back to the team, but want to let you all know we activated Severe Weather Shelter last night. We'll be deactivating later today. We're really grateful to A, be able to provide this life-saving support, and B, incredibly grateful to our partners that put in long hours, overnight shifts to ensure that folks are inside and safe during these events. You know, we expected to see a bit more snow on the ground. We're grateful that we didn't. I don't have numbers to report back yet. But in the last few events that occurred in January, we housed around 80, or we sheltered around 80 people during the severe weather event. So we're grateful to our partners for leaning into that and providing that life-saving support. Also, one other update I have, and this is a heavy one, y'all. The news has been hard. I know I have been deeply impacted by the federal action. I'm sure many of you have as well. And I just want to first take a moment to say, as people in this industry, as people in social services industries, as people that live or support Washington County residents. I know we are all impacted by the executive orders that came out on January 20th. And some of the other federal actions swirling. So I want to just say, first and foremost, Washington County is not walking back from our commitments on equity. We remain laser focused on our need to support our community and all aspects of our community, regardless of what they look like, where they live, where they were born. Those are not pieces that matter to us. We care about the person and serving the person. So I want you to hear that that's a strong commitment from the county. We know that, particularly from our shelter providers, some of the executive orders have been stressful. The potential for law enforcement coming into shelters is heartbreaking and really distressing for ensuring that folks feel safe coming into shelter. So we're watching that closely. Nadia shared out through the HSSN listserv some resources that are really important. So I encourage you to go to those resources, look at them. The one that I have found most helpful in digesting and understanding the impact of these executive orders has been the National Homeless Law Center's guidance for shelters. That came out, I think, the Tuesday within a week of that order. We're grateful to those federal partners for putting those resources out. Those are really important if you operate any public-facing service center. I encourage you. It does not just apply to shelters. It's really helpful tools, language to have for your staff, things that you can post up in your buildings. We'll include that again with this meeting summary, so you have access to that. But want to make sure that the National Homelessness Law Center's ICE guidance is top of mind. That is really helpful guidance. We in Washington County will continue to track this. We're working with our partners in Health and Human Services on guidance for our staff. We've been in communication with Oregon Housing and Community Services about additional state guidance. I'll just name that because the federal guidance that came out was so comprehensive, I think our state partners might be leaning on that a bit. But we'll continue to fight back and ensure that our folks and the people we serve are safe and feel comfortable accessing our services. And I want to encourage you, if you have questions, if you are aware of incidents happening, please let us know. It's helpful for us to know what questions you're having, so when we're working with our federal partners and our state partners, we can elevate those up and help support getting additional guidance and resources for you all. And then the last thing I want to say on this, just please take care of yourself. Our work is already really challenging. This is a really challenging moment to do this work in, and I hope that you're taking time to decompress. I have a no news day in my house. I think it's important to think about ways to take care of yourself and make sure that you can last through the next 4 years. We need you in this work. We can't do this alone. And we're so appreciative that our community shares our values. So with that heavy update, I want to go on to some other updates. I'll stay on the heavy side. And just give a report back on our budget discussion. You'll likely hear more about this during the Solutions Council update, but want to let you all know the Solutions Council has helped us kind of get to high-level budget categories for the SHS budget. Many of you know we were facing shortfalls of around $16 million next fiscal year. There are reductions made, and they're hard reductions, but we feel that we've done the best we can with the resources we have, and that's because of the feedback and the input of the Homeless Solutions Advisory Council. I'm doing a quick scroll. I see Abel on who serves on that council, and there might be others. I did a quick scroll and might have missed others, but just really grateful for our Solutions Council for providing that support, and we'll continue to work with them as we turn those high-level program commitments to contractual commitments with partners. So more on that to come in April and May. But just want to give that update that we've kind of landed the high-level conversation. And I see Nadia's just put on the chat. The last meeting of the Solutions Council is really where we get in depth about what's changing. So if you're interested in learning more, I encourage you to go there. And then I have one more piece of good news to share. Many of us have been tracking the potential Metro SHS referral measure. We've had some concerns, some questions about how it might work. I'm really excited to share that we've made great progress with Metro. Metro has been listening to the counties and most of all listening to service providers. The Welcome Home Coalition put in a lot of work to make the message of pause be heard. Metro is pausing on a potential SHS referral measure until November, and another stakeholder advisory group is being seated with a bit more elected official representation this time, more representative of where Metro would like to see a oversight body for SHS look in the future. So they're kind of preceding that now, and having them work on a potential reform measure. We see this as great progress. We're really excited that we're continuing to be invited to the table. We're grateful that our service providers are being invited to the table, and we just encourage all of you to let us know if you're hearing questions or have concerns. We continue to talk with the executive directors of our funded organizations and continue to uplift what we hear from you all to Metro. And then I have just some other good Metro news to share. For those of you that have been tracking the news, you know we have been long negotiating a data sharing agreement with Metro. While the agreement is not yet inked, we've come to a final intergovernmental agreement language, which is really exciting and wonky. And maybe I'm overly excited because I know all the pieces that went behind it, but it is a big step for our system to have that data sharing agreement almost in place. And we're making good progress as well with Metro on confirming the regional definitions for population A and B. So want to know there's a lot of fighting and infighting in the news. That's not necessarily what's happening on the ground. There's partnership happening. We're working in partnership on our supportive housing services program. So with that, I'm happy to answer any questions. And if not, I will turn things back over to Charlie.
Okay. Thank you, Nicole. If you do have any questions for Nicole, feel free to pop it in the chat or direct message her if you think of anything. So moving on to our next speaker, we have Kylie Camp and Dawn Zube.
You were close.
I was so close. That was, yep. Okay, thank you. They're going to be talking about the ODHS self-sufficiency program. Go ahead.
Thanks, Charlie. Let me get my PowerPoint up here. Let me get it shared. Hopefully everyone can see that. So thank you again for having us today. We'll do quick introductions before we get started. My name is Kaylee Camp, and I'm the Community Partnership Coordinator out of the Beaverton DHS office. And I'll let my co-presenter, Dawn, introduce herself.
Hi, I'm Dawn Zube. I'm in Tigard, so same position, Community Partnership Coordinator at the Cascade branch.
And we're going to talk today just some general basics around the ODHS self-sufficiency programs that we determine eligibility for out of our offices, and ways, different ways to apply and get connected with us. And if you don't mind, feel free to put your questions in the chat and we will get to those at the end of the presentation. So we have three self-sufficiency offices in Washington County, one in Beaverton, one in Hillsborough, and one in Tigard. Each of these offices are open Monday through Friday, 8 a.m. to 5 p.m. And the EBT window closes daily at 4:30 p.m. And that's the window where folks can come in and pick up a new EBT card that would have their benefits on it. So this is just a snapshot of the programs that ODHS determines eligibility for under self-sufficiency. You will have access to these slides and you're welcome to click on each of these to get linked into the website that has more information about each program, but we'll dive a little deeper into each of these as well. But just as an overview, we offer support with food, cash, childcare, medical, safety, and refugee services. So starting with SNAP, this program helps supplement a family's food budget, helps people pay for groceries. It also offers education about nutrition and then also access to job training. SNAP benefits allow individuals to purchase culturally appropriate unprepared foods. Just as a heads up, SNAP benefits cannot be used to purchase items like alcohol, tobacco products, pet food, or hot deli meals. And then also the SNAP program is intended to be a supplemental program and not intended to cover a family's entire food budget, but rather help stretch it throughout the month. So I mentioned that folks on SNAP have access to employment and training support. This is something that we often refer to as the STEP program. So this program provides job training, support, and helps SNAP recipients build skills and find work with the long-term goal of finding a living wage job. The program can help cover things like training, tuition, childcare, work clothing, things like that. This is a voluntary program, so it wouldn't have any effect at all on someone's SNAP benefits. And people can self-refer by sending an email to that email that's here on the screen, or they can contact any of our local offices and ask for a referral as well. And that's something that we can do. So moving on to our summer EBT program, this is fairly new. This officially started last summer of 2024. So this program helps low-income families with school-age children buy food during the summer when free school meals are not typically available. So families that are already receiving SNAP, TANF, or Medicaid benefits are automatically eligible to receive the summer EBT benefits. And then students who are eligible for free or reduced meals at school or are identified as homeless, migrant, or runaway are also eligible to receive summer EBT benefits. And summer EBT does not affect immigration status or public charge determinations. I know that we'll have more information coming out likely in the next couple months as we get closer to summer for families. But just also as a heads up, if you're working with any family that received these benefits, it's helpful to know that the benefits do expire 122 days after issuance. So then we have our employment-related daycare program. We often refer to it as ERDC. And this can support working families, students, and families that are receiving TANF. It helps pay for a portion of the childcare cost, including registration fees. So each family pays a copay determined on their income and their household size. Right now, the average copay is about $8, and it's 12-month guaranteed certification, which is great. The chart on the right has examples of the income limits for incoming families that are applying, and then the numbers that are below show for ongoing. So after a year being in the program, when it's time for a family to reapply, they're no longer being looked at the 200% FPL. There's a higher income limit to give space for, job promotions, raises, things like that. And then also the program is now under the new agency, the Oregon Department of Early Learning and Care, also called DELC. But we at ODHS continue to determine eligibility for this program. And so typically ERDC is for kiddos that are age 13 and under the age of 13. However, kids that are between the ages of 13 and 17 years old who need care can also receive care depending on certain circumstances. Along with this, the family is the one that chooses their own childcare provider. The childcare provider does need to be approved to receive ERDC payments. And one nice thing about this program is that family members, friends, neighbors, they can all apply to become a certified provider so that they're able to provide care and get paid for that care. There is some training and a background check that they would have to go through, but it's a fairly simple process if families know someone that they trust, they're interested in having watched their kiddo, especially because we're really low on childcare providers right now, especially in Washington County. So with that, there is still limited funding for the ERDC program, which means that we have a wait list in place. In Washington County, there are currently 2,050 enrolled families, and 83% of those families are currently connected to a provider. There are currently 677 approved ERDC providers in Washington County, and we have 1,450 families currently on the wait list. And the DELC website has some really great dashboards about this information and current numbers per county and then statewide as well. So there are some exemptions to be able to bypass the wait list, and they're listed here on the screen. So that includes families that are currently receiving TANF or temporary assistance for domestic violence survivors, families referred by child welfare, families applying for ERDC within 2 months of their benefits ending, families who receive TANF or TADBS within 3 months of applying for ERDC, or families that are eligible for an ERDC contracted slot. So temporary assistance for needy families, we often call this TANF. So this is monthly cash assistance and family coach support. The goal of the TANF program is to stabilize families, support child well-being, and help families stay together. There is a 5-year lifetime limit for adults. However, children can remain eligible for this program up through their 18th birthday if other eligibility requirements are met. And with that, as I mentioned, most families receiving TANF will work with an assigned family coach, and they can help get them connected to different resources, support services, and then we also work with a number of contracted providers, which we have here listed on the screen. But there's lots of different supports that family coaches can help provide to families that are receiving TANF. Next, we have our temporary assistance for domestic violence survivors, sometimes referred to as TADBS or just the DV program. And so recently the payments for this program went up to $3,200. It used to be $1,200, which is great. It's been a really long time coming that we've been waiting for that increase. The purpose of the payments are to remain safe or gain safety. So many survivors will use these funds to relocate, find safe housing, or if they're in a space where they feel like their home is safe, but they just want to feel more safe, they can purchase things like security cameras, Ring cameras, things like that. They do need to have a child or be pregnant. The child doesn't necessarily have to be with them if they're not with them because of the domestic violence. So that's something that the survivor can discuss with the family coach at the time of the intake. And we do work with the Domestic Violence Resource Center to provide safety planning and ongoing support for survivors. And we currently only have one outstationed at our Tigard office, and they're supporting our district, but we typically have 3 located out of each of our offices. Oregon Health Plan is Oregon's Medicaid program. And so OHP, it typically covers things like primary care, hospital services, prescription medications, mental health services, and substance abuse treatment. There is also some limited dental care for adults, and then also covered for children, and then vision care and hearing aids for children and certain adult populations. People can apply for OHP any time of the year. And as of July 1st of 2023, people of any age or immigration status may be eligible for the full OHP benefits, whereas before, certain folks were only eligible for emergent benefits for OHP. And then our refugee cash and employment program. So refugees and others with an eligible immigration status can get help with cash, medical, and employment services. And so we've contracted with local resettlement agencies to help refugees get connected to these services. So that's typically the way that we see folks come in and apply for this is if they've been working with a local resettlement agency. But refugees can receive up to 12 months of this support. And it is also funded by the Federal Office of Refugee Resettlement. And now I'm going to turn it over to Dawn.
Thanks, Kaylee. You did all the heavy lifting. Great job. I'm going to just cover a few more details, ways to apply and connect with Department of Human Services. So in an ongoing effort to meet people where they are and make applying for benefits as accessible as possible, we have 3 ways to apply: online, by calling, or in person. So the one system rolled out in our area in 2020. It's a collaboration between the Department of Human Services, the Oregon Health Authority, and DELC, the Department of Early Learning and Care. So as the name implies, you can apply in one location for most public benefit programs. The one program that you cannot apply online is the temporary assistance for domestic violence survivors, just due to the urgent nature of that request. So how does that look? Once somebody applies for benefits, they're contacted to schedule an intake or an appointment to determine eligibility. If they show up in person, that's scheduled right at that time. If they apply online through the applicant portal, they receive an email that tells them to call their local office to schedule their appointment. Then it goes into a queue where they get 2 cold calls from eligibility workers. If they answer the phone, they will get the intake done at that time. If nobody answers the phone, it goes into a slightly different queue where a scheduler calls and tries to set up an appointment with them. So 4 calls in total. At that point, if there's no contact made, a letter is sent with an assigned appointment time. So just so you see a little bit of the behind the scenes process there. Once somebody's approved for benefits, they do need to get an EBT card, electronic benefit transfer card, or otherwise known as the Oregon Trail card. It can be mailed to them, or it can be picked up at any office. And our in-person hours are 8 to 5 for any branch that somebody walks into. The VEC, the Virtual Eligibility Center, has a little wider window from 7 a.m. to 6 p.m. Once somebody's applied through the applicant portal or created an account through the applicant portal, they can use an app that's been developed. Both systems are under development continually, improving based on feedback from users and workers. So if you have thoughts, please contribute them to the process of improving this program. But the One mobile app allows participants to make changes to their benefits, upload documents, provide verification of benefits to, say, Community Action or other agencies that they're looking for support from. So it really can help to minimize the backlog of requests that come into the Department of Human Services, and we're trying to get as many folks using it as possible. So again, starting with the applicant portal, which is a web-based program to create the account and apply, and once somebody's applied, then they can manage their benefits through the mobile app, which is much more user-friendly for folks with smartphones anyway. Oh, here's an example of some of the things that you can do with the mobile app. You can check your case status and see any actions needed for your case. You can take pictures and upload supporting documents. You can view the notices that have come to you by mail. You can check due dates for when your renewals are due. Get important and time-sensitive alerts and notices about your case, and again, report any changes, such as a change in address, a change in your income, or other updates that are needed. This slide shows a comparison between the two. So the One online account is a web-based system, and the mobile app is a little bit more limited. So applying for benefits, renewing benefits, you have to do that through the One online account. Most everything else you can do through the app. And it's probably the most convenient for showing what your current benefits are. Discounts and benefits for self-sufficiency program recipients. This is important for folks to know that even if your SNAP case is is minimal. You're getting $10 of benefit or even $0 of benefit. As long as you have an open SNAP case, you're eligible for these various other supports in the community. Amazon Prime, you can get Amazon Prime for $6.99 per month. You can get Comcast's Internet Essentials for $9.95 per month. For the Oregon Zoo, you can buy up to 4 tickets for $12 each for your immediate family. There's some class fee waivers at Portland Community College for SNAP recipients and OHP recipients. And then, of course, TriMet has their Hop Pass, which you can get for $28 a month when you show that you have an EBT card in an open SNAP case. So lots of reasons to apply, even if you're getting a very small amount of SNAP benefit. The food markets, this is a personal favorite for myself. We have 2 food markets happening in Washington County. One is in Hillsborough, one is in Tigard. These are truly the Oregon Food Bank's events. They're donating the food. We're just hosting the event. So it's a very low barrier day. People don't have to show ID. They don't have to present any kind of identification. If you show up, you get some food. And it's primarily pantry items and vegetables and fruits. Fresh, rarely is there meat available, but lots of good stuff. It takes, $100 off your food budget that month. And if you attend both, even more so. We at ODHS also have a resource fair in combination with our food markets. So folks come through, get the food, and then they visit with several community partners. And many of you are on the call, I believe. Often community action is present, the Oregon State University Food Hero Program, Early Learning Washington County has been at almost every market. School district representatives from resource centers, migrant ed program, McKinney-Vento advocates, and several other partners. So it's just a good place for folks in need to touch base with other supports in the community. At both markets, we've had free diapers available. The availability of sizes varies slightly with what funding we can get a hold of and what donations we have. But again, these are pretty wonderful events. Any of you are welcome to come and participate in the resource fairs, and please send folks our way. The Hillsborough market is the 2nd Tuesday of each month, the next one being February 11th, and the Tigard market is the 4th Monday of the month, with the next one being February 24th. This page has some helpful links for partners. So if you're working regularly with Oregonians needing to apply for benefits, these are good links to have handy. The first one, the Partner Welcome Guide, is a 4-page summary of all of the self-sufficiency programs and some information about them. Handy links. The second link down there, the Partner Resource page, offers a window into 2 different meetings that happen monthly. One is for self-sufficiency programs. One is for SNAP specifically. And there's questions answered, information provided, updates offered. So that's a good thing to be aware of. There's also videos. So if you want to just zip through and check out what was talked about, that's probably my recommended method to do so. The one eligibility system link there has everything to do with eligibility and applying. There's some how-to videos, how to use the one online system, how to use the one mobile app. There's links to the Spanish webpage and interpreters. There's a QR code for getting to the mobile app. So lots of information if you're supporting people that are applying for benefits. ERDC waitlist toolkit. As Kaylee mentioned, there's been a waitlist for about a year now, and there's a lot of questions about how that process works. That toolkit offers many resources and answers to those questions. And then the bottom link, OHP Assisters are out in the community providing culturally and linguistic responsive outreach. They're helping people apply for medical benefits. And if you're interested in becoming an OHP assister or have questions about that process, you can find it there. And then lastly, there's many opportunities to volunteer for Department of Human Services and certainly to donate to any of our agencies. We share our resources across the entire district. We have donations coming in from Costco, from the Good Neighbor Center, from Fran's Bakery, from various different friends in the community, and we try to make sure those are getting to the folks who need them most. There's a link there. Click here for more information and volunteering about volunteering and donating. That will take you to something of a landing page where you can apply to be a volunteer. You can see what on our Amazon list we're most hoping to get donated, and more information about that whole process. If anybody you're working with or yourself is interested in becoming a staff member at the Department of Human Services, volunteering is a wonderful first step. You get familiar with the language and the setting and the kind of the values of the agency, and then that really helps when you're interviewing for a job. And I think that's it.
Yes, I'll stop sharing so I can see the questions here, see the chat. Okay, let's see. I see a question here. Do families receive the summer EBT only if they have school-age children? Yes, so it's for kids 6 to 18 with the intention of it helping to cover some of those costs during the summertime when the kids are no longer receiving their meals at school. Any other questions we can help provide? We can put our email address in the chat as well. So if anything comes up later, feel free to reach out. We're also here to always help navigate. If you're working with the family and they're having a hard time either connecting with us or understanding what's going on, we're not eligibility workers, but we're happy to help families navigate and get the support they need. So thank you again for having us. We appreciate the time. Oh, I see another question. When they have to renew their benefits, does the app help them with notifications to renew? I believe so, that you can sign up for notifications, and there's different options. You can do email, you can do text, mail. You can have all of those options for notifications. So yeah, through the app, through the desktop website. Also, typically things are mailed to a person's home as well, letting them know when it's time to reapply.
And you can view any letter that came to you, you can view in your account. So that sometimes helps clarify what's going on if there's questions.
Yeah, we'll put our emails in the chat.
And Kaylee mentioned it, but we are good points of contact. If you have any questions or you're trying to connect with somebody within the agency, we can help you navigate and get to the right person. Thank you.
Thank you. So Jorge, I see your hand, but can you send the question in the chat? Because we do have to move on to our next speaker. But
yeah, I can send it
thank
in
you.
the chat.
What was that?
Yeah, I can send it in the chat.
Okay. Thank you, Don and Kaylee. Okay. So wealth of information, super good. I'm going to hand it over to Kelsey Heath, if you're ready, from MPD Law. Kelsey, whenever you're ready.
Yes, let me share my screen really quick. Give me 1 second. I'm gonna try to full screen this. There we go. Is that working?
Yes.
Okay, cool. So hi, my name is Kelsey Heath. I'm the Senior Case Manager with Metropolitan Public Defender. And April and Issa are our other two case managers. I think April might have to step off for a meeting at 10:30 or 9:30, and then Issa is visiting a client right now. So, but yeah, you can contact any of us if we have a shared client. Okay, so for anybody who hasn't worked with our team or an MPD attorney, we're the largest nonprofit public defense contractor in Oregon. Our office only represents indigent clients, so those who can't afford an attorney. And we represent people facing criminal charges, juvenile delinquency charges, and juvenile dependency charges. Cases in both Washington County and Multnomah County. We only work in Washington County, but sometimes there's crossover. So, and part of our mission is to provide holistic defense, which means we aim to provide the most wraparound services as possible as part of our defense. Which is why we have case managers. We work as an interdisciplinary team with folks, attorneys, and investigators and legal assistants. I didn't include it here, but I think it's of note given all the things, but we do have a community law division downtown. When folks have a criminal case, our attorneys are collaborating with our immigration lawyers downtown to try to determine any collateral consequences that could come from a conviction. And we're often reaching out to those attorneys on cases that we work on, even if it's like a dependency case, like we just want to support people again as holistically as possible. And then our community law division also provides some limited civil law services for Washington County. There are some services that are solely Multnomah County, like their eviction defense services are solely Multnomah right now, but hopefully maybe that'll change in the future. So our team receives referrals from MPD attorneys. We don't work with every single client that MPD represents because we would be very tired and we're already pretty busy. So we tend to work with clients who their attorneys have identified that they have pretty complex extra legal needs. So that usually means that they are experiencing housing instability. They might need substance use treatment. They might have unmet medical needs, unmet mental health needs, and require support with all of those things or a few of those things. And so we working with our team is entirely voluntary. So if we're working with a client, that means that they are on board with working with us, and that could change at any time. But we work with them throughout the life of their case, and we're ideally transitioning them to longer term systems of care by the time we close out their case. We don't necessarily have like a hard stop working with clients. Once their case is closed, their attorney steps off and is no longer representing them. But there are times when we have like a window of time when we're still supporting someone, even though their case is closed. Yeah, I mean, a lot of what we do is like connecting folks to community resources. And so sometimes that means working with someone's housing case manager. So we interface a lot with that system, and we're able to do phase 1 assessments with folks. And then sort of similar in the juvenile dependency world, but we're representing a mother or a father or a child in a dependency case. So for parents, generally that means that we're trying to support them and working towards reunification with their child. That's not always the case, but generally that's the goal of the parent. For youth, it's usually an older foster youth that is seeking support with independence related services. A large proportion of our clients are in the aid and assist process, which means that they have a qualifying mental health condition that is impeding their ability to work with their attorney and resolve their case. So their case is kind of put on pause so that they can receive mental health treatment, substance use disorder treatment if pertinent, and legal skills classes so that they can hopefully regain competency and proceed with their case. So we work with both people that are sent to the Oregon State Hospital from the Washington County Jail, and then also folks who are eligible to receive those services in the community. And so the population, this specific population faces a ton of barriers, which is why I wanted to talk more about it. Sometimes when people are in community restoration, for example, they are they're in transitional housing, but it's county funded transitional housing that comes with an array of services, and can't say enough wonderful things about the providers that provide those services, but they are temporary, right? And so when the person's case closes, regardless of whether they're found able to resolve their case, or if their case is dismissed, they suddenly don't have those resources. And so I feel like it's very important to note that those people very much need support, because they go from a level of stability to not having any at all. So we try to transition people as best as we can, but yeah. So a lot of what we do for our in-custody clients is release planning, but we also work with folks in other institutional settings. And as part of release planning, because we work with people who are pretrial, the judge will impose certain release conditions that they start with. So those can look like a responsible third party to sign them out, where they have to live with that person throughout the duration of their case. And that person is responsible for reporting them for any violations. A GPS monitor, which they have to pay for, which is sometimes a barrier. They might have bail. They might be on house arrest. And those are all things that could theoretically change if additional supports are in place, because a lot of our clients don't necessarily have a responsible third party that they could live with. Otherwise, they would already be living with them. And then they might not have the income to be able to pay for a GPS monitor or bail. And then house arrest comes with a slew of other things, like people can't go to the grocery store. So yeah, like I said, they can be modified. And that's a lot of what we do, is we support the attorneys in trying to find alternative options so that clients aren't necessarily held just because of their lack of ability to pay or have a human that they can live with. So we do phase 1 Community Connect assessments with, any client that qualifies for that assessment, and keep them updated while they're in touch with us. And it's usually the first thing that we check is oh, do they have a housing case manager? Let's reach out, if we're assigned a client. So it's very wonderful when we're able to introduce clients to their housing case managers, if they have one, while in custody, because it goes a huge way to building rapport. And yes, you're behind glass, but there is a lot that you can do and get done while someone is in custody. And yeah, I think we support housing case managers by writing reasonable accommodation letters that speak to people's pending charges and all the things. And yeah, we support in a really broad way. So there's not a yeah, our work is really broad with clients. So it's kind of just filling in the gaps. So we're happy to support, usually in a lot of ways within reason. So our clients face a lot of stigma because of their court involvement that can extend to service providers that are working with them. People don't, whoa. Oh, sorry. Good Lord. People don't stop needing services while in custody or in the Oregon State Hospital, for example. I think it's important to note that, though though HUD hopelessness definitions are the way that they are. Some of those definitions, they contribute to people like cycling in and out of jail or the hospital back to the street. A lot of people are in jail over 90 days simply because they can't pay for their bail, and they don't have a release plan and they don't have support. So it presents a lot of barriers for folks. So like I always encourage people to, give grace to the people that are in custody and or in the hospital, because again, there's still a lot of like good work that can be done with people while they're in custody. And it can make a huge difference for them when they resolve their case, or however they do that. Yeah, sort of touch on this, but like release dates are often like determined by whether they have a safe place to discharge. And that could be a variety of locations, kind of depending on what the person's needing. About 2/3 of people nationally in jails are held pre-trial, so they have not pled guilty. They haven't received a conviction for the case that they're being held on. And so there's often no release date like listed on the jail website, which can sometimes be a barrier because you look and they're like, hey, we don't know when they're going to be released. Like it could be any time. And so, but they could be forced released at any time. So it's important to, make an attempt to see them while they're in custody, if possible. Yeah, even if it's not an MPD attorney, try to figure out who your client's attorney is, because I'm positive that they'd be happy to hear from you. They aren't necessarily like knowledgeable about like the housing system. They're not necessarily knowledgeable about the resources in the community that might help their client get out of custody and have more time to resolve their case thoughtfully, and be able to work on getting housed in the community and getting services. I'm going to talk a little bit about how to figure out if your client is in Washington County Jail. So the website is called Who's in Custody. There's the link. I just Google who is in custody every time and it just pops up. So it's updated every 2 hours. So it's not like the most accurate thing on the planet, but if it's within 2 hours, you'll be able to see if your client is still there. And again, the information is not always like the most accurate because there won't be a release date listed if they're pre-trial. Sometimes there will, but that's not necessarily the case. So yeah. And so to visit clients, if you have a MPD client, please feel free to reach out to us, even if it's not someone that's working with our team. If we have permission to share that information, like per the attorney, like we will connect you with their attorney and you can go from there. And if they are deemed like someone who might benefit from working with our team, then it's possible that the attorney might send a referral and then we can collaborate with you that way. This is kind of the process to get approved to be a professional visitor at the jail. Contact Stephanie Brown, who's the administrative specialist there, and bring a letter through your organization. And then once you're approved through Ms. Brown, you can bring a copy of that letter and your government ID to the jail lobby and tell them, they might ask you like, is this your first time here? And you can say, yeah. And they'll have you fill out like a quick piece of paper with some basic rules for visiting. And you should be able to go visit your client. And if you have any questions about like that process, feel free to reach out as well. We also accompany people a lot of the time to the jail just to not do a warm handoff necessarily, but just to do an introduction. The CCC is a facility across the street that is kind of like jail light. It's like dorm style. People can wear their own clothes. They can go outside. If they're sentenced, they can go to treatment or to work or things like that. If they're pre-trial, they can't do that, but it's significantly easier to visit folks in the CCC because the visiting hours are more broad. So And there's no glass, so you can get paperwork, which is lovely. So a couple wonderful people to know about. Casey is the discharge planner at the Washington County Jail. She's wonderful. She reactivates people's OHP on their release. She's the person to help order discharge medication, gives people resources all the time. She's amazing, and does a whole lot. So she might be able to support. You might need to get a ROI, or she could, get an ROI from them for NAF care. That's the jail's medical provider. And then Bruce is the mental health liaison. His main job is to facilitate between jail medical and outside systems of care. So whether that be someone's mental health provider or their housing case manager, if they have, a mental health diagnosis and are needing support connecting to outside services, and he's kind of the person to bridge that gap. So, and then Julie is also wonderful. And she used to be a ICC with Washington County, but is now working with people in the Washington County Jail who are Health Share Care Oregon clients, and is supporting with care coordination for those folks on the way out. So that can look like meeting with them once and giving them some resources, or like kind of following them a little bit on the outside if they need some more care coordination. You can contact the verifier's office to figure out who your client's attorney is if they don't know. I encourage people to reach out to their client's legal team, even if it's not an MPD attorney. If they don't have permission to talk to you, then they may not respond, but 9 times out of 10, people want to talk to their housing case managers or outreach people. And so it's been very rare that I've had a client be like, no, I don't want you to talk to them. So, so I think 9 times out of 10, whoever the attorney is that you're reaching out to might be able to help you either get in touch or be able to, provide you some information on how to get in touch with them. Yeah, again, attorneys don't necessarily know. They can't look to see if someone's connected with housing case management. And yeah, it can be like huge to have another person to support. Not all public defense attorneys have case managers. And so it's just instrumental to have another avenue for support for clients. If clients want you are more than welcome to show up in court. It can mean a lot to judges. It can mean a lot to the client just to have an extra support person there, because court can be very stressful. If you're working with someone in custody, it's very important to keep their HMIS profile updated so they can stay on the list for matching. They can call Community Action. They can call Community Connect from the jail. But a lot of the time they have to leave a voicemail and Community Action can't call them back. So, yeah, I am hopeful that ultimately, like, there will be a better way to directly transition someone to shelter, because we have a lot of folks who are released before that they have kind of a plan in place, and getting into shelter without contact information is, as a lot of people know, a really huge barrier. And yeah, we're happy to collaborate with you if you share a client with us. We might bug you first, and yeah, that's our contact information. So feel free to reach out. Ooh, I guess I'll stop sharing. Oh, things. Okay, any questions or anything? Oh, yes, sorry. Just the slide with our contact information.
Thank you, Kelsey. If you have any questions, just feel free to direct message Kelsey or reach out on that contact slide. Snap a quick picture in your mind right now. We do have to move along. We have had no request for public comment. So we're going to move on to our next speaker, who is Fletcher Nash from the Miracles Club. Whenever you're ready, Fletcher.
Okay. Can everyone hear me?
Yes.
Yes.
Oh, okay. I'm like, okay. Thank you for allowing me this opportunity to speak. Unfortunately, I couldn't get the PowerPoint ready because it's been changing for the past couple of years. We have went from maybe 6 people to now we're over 40. And so our organization is really growing. The Miracles Club was founded in 1993. It is a Black peer-led recovery center committed to providing safe spaces for marginalized, historically oppressed, racial and ethnic groups. We serve all individuals that, come through our doors. Just to tell you a little bit about some of the programs that we have long-term and short-term housing. We have basic needs assistance, peer mentors with lived experience. We have acupuncture at our club. Before I go too far, we are new to Washington County. A lot of our services are in Portland, but everyone who we work with in Washington County is eligible to access all our programs we might have. Also, depending on their justice involvement, they are able to move into our housing, even though it may be in Portland, and we're working with them in Washington County. We have acupuncture twice a week from 2 to 5. We have a wellness within reach program where people can get a pass to go to the parks and recreation, gym and pool and stuff like that. Even though we're in Portland, we have 2 kind of close to Beaverton. If anybody is familiar with the Southwest Community Center and the Multnomah County Arts Center in Multnomah County. So if you was to get a pass, it's $25 for 3 months, and you'll be able to go to any of them parks and utilize their services. We have a harm reduction program. We have Medicare education advocacy. We have a clothing closet. Our clothes inside of our clothing closet, and we have a small one in Washington County that we have put out there. All our clothing are new. And then also we have community events that we do every year. We just brought back the Soul Stroll. It is a 2.5 and a 5K walk. We do a backpack giveaway. We've been doing that for the past 4 years. Last year, we gave away over 300 backpacks with school supplies. Also, when we do our school supplies, we have food and games for the kids, and we have haircuts and hair braiding, and Miracles Club purchased the hair for the kids. We also have an expungement clinic that is every first Monday of the month. And then we do a New Year's event. We are also open 7 days a week from 8 a.m. to 10 p.m. And for the first time this year, we were part of the air conditioning program where we installed over 750 air conditioners. And our mentors, I got to hand it to them because, we told them that they have to do it outside of their working hours for the Miracles Club. So this was like a program. They just volunteered their time to do that. And like I said, they installed over 750 air conditioners. We have 2 apartment buildings. We have partnered with, over the years, we have partnered with organizations like Oregon Health Authorities, Multnomah County, Central City Concern, Guardian Real Estate, Health Share, Quest, Bridges to Change, MacBowl, 4D. And just to tell you about a little bit more about our programs, we have two apartment buildings. We have one at the Miracles Club that houses about 40, 45 units. And then also we have Miracle Central, where we partner with Central City Concern, hence the name Miracle Central. We have 5 transitional housing, and one that we're putting together now will be 6. We have a men's house, we have a women's house, we have a pathway house where they don't have to be clean and sober, but they can't use inside the house. It's to kind of, get them a feel for sobriety. If they can get 30 days clean in that house, they move to the next step. And if they can get 30 more days clean, then they can move to our transitional housing. We have an LGBTQIA community house, which is called the Expressions House. Also, we have a couples house that's just been open. It's probably been open about a month. And that's about it. If anyone have any questions, feel free to, send me questions via email. It's Fletcher@miraclesclub.org. Okay. And also I have a couple other, I see Tomas, he is our grants and development person. Would you like to say a few words?
Sure. Good morning, everybody. Just to introduce myself, as I just want to express, as Fletcher already has, that we're really grateful to be part of this network, as we're just getting off the ground with our work in Washington County and have recently implemented on-the-ground staffing to work in the justice system, and then operations with the plans for a transitional housing situation within the coming year. I think it's important to recognize that these networks are vital to our work in Washington County as a referral-based organization. Our clients are free to walk in the door at any time, 24 hours, as Fletcher said, from 8 a.m. to 10 p.m. But also that a lot of our clients are referred to us because of our cultural specificity and our ability to respond to their unique needs, whatever those might be. So I think it's important for us to get our feet wet in Washington County this way with and I appreciate the presenters who came before us, just in getting an understanding of what the landscape looks like in terms of services already provided. And we are excited to be a part of that network and look forward to serving as a resource to everyone in this network that would like to direct clients our way. We are operational in Washington County, even though our operations are primarily in Portland, but we intend to grow, and we will be there up and running, as I said. So we just look forward to the expansion of partnership and programming in the spirit of collaboration, and just appreciate the invitation to present our work as we get started.
Thank you so much, Fletcher and Tomas. If you don't mind, Fletcher, could you put your email in the chat so that if people have questions, they can reach out?
Yes.
Okay, awesome.
All right.
And let's see, moving along. Okay, time for general business. So we have healthcare and housing with Benjamin Jacob, as well as Solutions Council update from Kim. I think we have time for both. So Benjamin, if you want to take it away, go first.
Yeah, definitely. Thank you, Charlie. Can everybody hear me okay?
Yes.
Okay, awesome. Hey, everybody. I'll keep it pretty quick today. If you don't know me, my name is Ben Jacob. I'm the Medicaid Team Program Coordinator with the Department of Housing Services. So I work on projects that look to integrate our kind of housing ecosystem with our healthcare systems. I figured the main update I could give you all today is about the new health-related social needs Medicaid benefit that's recently been launched by the Oregon Health Authority. A little bit of background. I'm not going to give you the full details on this benefit, but I'll give you a little background. Health-related social needs, or HRSN, is a Medicaid benefit that provides services to Oregon Health Plan members that aren't usually covered under traditional Medicaid. So Medicaid, of course, is the low-income health insurance plan that's offered by our state here in Oregon, Oregon Health Plan. It includes support for things like climate devices, so like air conditioners, housing supports, like rental payments, nutrition supports, like medically tailored meals. And it specifically seeks to support folks who have a co-occurring clinical need, so that's something like a severe and persistent mental illness, as well as a social need, like a risk for homelessness or food insecurity. The aim of the HRSN program is preventative. I think it's no secret, right, that when a social need like housing is unmet, folks with medical diagnoses end up getting sicker, and treating those medical conditions gets a lot harder, right, when somebody has lost their housing. So this program kind of seeks to meet those social needs in order to prevent Medicaid members' illness from getting worse. Since this is the housing network, we'll talk kind of mainly about the housing benefit here. And as of right now, those housing supports are only offered to individuals who are currently housed and at risk for homelessness. The main housing support is rental payment, so it will offer 6 months of ongoing rental payment or 6 months including some arrears as well. And I'm sure most of you are probably already familiar with this benefit, but I wanted to give you all kind of a current state of how the benefit is going in this rollout. It went live in November, and currently the housing benefit referrals are still backlogged. The waiting time to get this benefit has increased, and right now we've been advised it is taking up to or longer than a month, which is, of course, a really long time if you're facing eviction. And this is due to just the sheer number of requests that are flowing in to the referral partners, which is 211 and our coordinated care organizations, Care Oregon and Trillium. So our health system partners, and that's 211, and those coordinated care organizations have ensured us that they're working really hard on this. They've increased their staffing. They've hired emergency staff to help address this big backlog. So this delay problem is improving, but I did want to share with you all as our network here in Washington County that this benefit is not a great option right now for folks who are seeking urgent eviction help. If you are working with an Oregon Health Plan member who's facing an eviction and does have one of those kind of qualifying diagnoses, you should still apply for this benefit. Get your application in, keep following up with 211 in the health plan. Just be aware that the response time is slow right now. So be considering all of your possible options. Finally, I did just want to say that if you're interested in performing this work, the problem we're facing right now is very much a capacity problem. We don't have enough people doing this work, so of course we're not going to be able to meet the need. The Oregon Health Authority is releasing another round of community capacity building grants, which are designed to help organizations build up the infrastructure to do this kind of Medicaid work, specifically in the health-related social needs field. These funds are going to be coming sometime in the spring or early summer of this year. So just please keep an eye out if you are interested for communications by the Oregon Health Authority, or go ahead and reach out to me on the Washington County Medicaid team, and I'd be happy to keep you in the loop regarding any upcoming funding opportunities. I'll go ahead and drop my email in the chat, and you can definitely reach out to me if you have any questions about this. But that's all I wanted to say. Keep it pretty quick for today.
Thanks, Ben. We can move on to Kim with the Solutions Council update. Kim, whenever you're ready. Or maybe Kim's not here, and that's why Lindsay said that we can move past that update. Kim Marshall or anybody from Solutions Council want to give an update? If not, we can move on to announcements.
I think actually Nicole covered a lot of it, and
Okay.
the link that I shared earlier is for, you know, if anyone's interested in watching the previous meeting from January and getting those updates or reading through any of the materials. So that might be the best way to get those
Great.
updates.
Okay, let's move on to announcements. So just want to say, if you or your agency are interested in offering a presentation during our HSSN meetings, super important. We want to get all the information we can to everybody out there so that we're collaborating, working together, especially during the times we are facing. Please reach out to Lindsay and Lindsay will drop the email in the chat to reach out to her. So if you or your agency is interested in giving a presentation, reach out to Lindsay. She's going to drop her email in the chat. So our next meeting is going to be March. Hold on, it says February 5th, but let me look at the actual next meeting date. So the next meeting date is going to be March 5th at 8:30 a.m. Nice. And just reach out with agenda topic suggestions and agency highlight interests. And I'm going to open the floor now and see if anybody wants to unmute or put in the chat for any events, any kudos you want to give out for the day, any highlights, anything like that. So we can open the floor for that now. I'll just say today's presentations, we got like a wealth of information. I'm really excited to trickle this down to my case managers and whatnot. So this is great. Thank you for everybody that presented. Oh yeah, and happy Black History Month, everybody. Lindsay posted something about that in the chat. Some kudos in the chat. And then Lindsay did just drop the February Learning Community Center. I'm going to give one more minute and then I will release everybody 10 minutes early. If anybody has any last words. Okay, new narrative is hiring. Yep.
Maybe a quick reminder that
Yes.
the Portland Homeless Connect event in Hillsborough is February 14th, and DHS will have some eligibility workers there. So if anybody's
Amazing.
needing to open food benefits or medical benefits, they can find our van there.
Awesome. Thank you, Dawn. Yeah. Awesome. New narrative is hiring for multiple roles. Spread the word. We need more people in this work. Nice. Okay. Well, I will call this meeting adjourned. Thank you, everybody, for your continued participation. And I hope everybody has a great Wednesday. I'll see you all next month. Bye, everybody.